We want what the patient wants. What are their expectations going into surgery? Which patient is good for gastric sleeve, a gastric bypass, or a mini gastric bypass? That is a very common question, actually. We have to take into account different things, different aspects of every patient is different and every patient has different characteristics. So the surgeries, there's not one surgery for all the patients because we have to tailor the surgery depending on the patient's needs. And those characteristics are going to be gender, age, and also if they have or do not have acid reflux, if they have or don't have diabetes, high blood pressure, other obesity-related conditions. Also, another thing that we take into account is if the patient has had a previous surgery, bariatric surgery, and what surgery was done. And the process of getting to know the patient, to talk to the patient and decide which is best for him or she, it's a complex one because the characteristics of the patients are different, and it's something that we would have to decide once we have the patient in front of us, or once we have the medical information. We want what the patient wants. What are their expectations going into surgery? If the patient wants to have a gastric sleeve and doesn't have any contraindication, then we try to give the patient what they want. But if for some reason there's a contraindication for one or the other surgery, we have to guide the patient and we have to explain them why it's not a good option, why do we think it's better option this or that. So it is a complex thing. It's not white and black. There are gray areas. So that's why it's very, very important for the patient to get in touch with the surgeon, not only with the surgeon, but with the whole medical team. So we can make the best decision possible for them.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.